Hello, my name is Maggie or Margaret Swiderski, and this is going to be my video presentation for Module 3. So in this next section, I'm going to be giving a general description of the epidermis, dermis, hypodermis, as well as the layers of the epidermis and dermis. So the epidermis is the most superficial layer of the skin, which functions primarily as a protective barrier against injury, as well as preventing water loss. So there are 5 layers to the epidermis, and the most superficial layer is the stratum corneum, which is composed of dry cells that do not have nuclei. The next deepest layer is the stratum lucidum, which is also known as the clear layer, and this layer also lacks organelles and a nucleus. So deep to that is the stratum granulosum, which is the most superficial layer of the epidermis that still has functioning nuclei. And this layer also contains keratinocytes that produce keratinohyalin and keratin. And the next deepest layer is stratum spinosum, which has keratinocytes similar to the last, but it also has Langerhans cells and melanocytes. So the very deepest layer of the epidermis is the stratum basale, which attaches the epidermis to the basal lamina, and it also contains stem cells, melanocytes, and Merkel cells. So the dermis lies deep to the epidermis, and it consists of loose connective tissue above a dense network of connective tissue fibers. And there are 2 layers to the dermis, the superficial papillary layer and the deeper reticular layer. So starting with the superficial papillary layer, it is composed of loose connective tissue that contains blood vessels, fibers, macrophages, and fluid ground substance. And the deeper reticular layer consists of fibers in an interwoven network of dense, irregular connective tissue, and it surrounds blood vessels, hair follicles, nerves, sweat glands, and sebaceous glands. And finally, we have the hypodermis, which is also known as the subcutaneous layer, and this is composed of loose connective tissue and adipocytes, and this stabilizes the position of skin in relation to the underlying tissues while still permitting independent movement. Next, I'm going to give an example of clinical application in relation to my future career. So I want to be a physician assistant, and I also work with many of them in the emergency department. And so an example of a clinical application involving the skin would be laceration repairs. So for example, if a laceration only cuts through the epidermis and the upper part of the dermis, the patient might only need skin glue. However, if this laceration cuts through the lower part of the dermis or the subcutaneous layer, they may need stitches.